output is a way for us to quantify the amount of blood flow that's going through our body. So of course, I'm going to compare this to the respiratory system, and we're going to compare this to our minute ventilation. So if you remember minute ventilation, it's the tidal volume times the respiratory rate, and that equals your minute ventilation. So our tidal volume is how deep we breathe, and our respiratory rate is how fast we breathe. So therefore, we can quantify our ventilation through that minute ventilation. And if you took the entire population, the average minute ventilation is 4 liters per minute. Well, now let's look at our cardiac output. It's the volume of blood each ventricle pumps in liters per minute. So cardiac output equals heart rate times stroke volume. So stroke volume then would equal cardiac output divided by heart rate. So stroke volume is the volume or the amount of blood each ventricle ejects during contraction. So you could compare stroke volume to tidal volume, and then you could compare heart rate to respiratory rate. So our cardiac output is the quantification of the amount of blood that gets pumped by our ventricles in liters per minute. Average, by the way, is 5 liters per minute. So once again, this is a very important concept. I keep stressing it. Minute ventilation is 4 liters per minute, and cardiac output is 5 liters per minute. And we want a good balance there, because it's really the respiratory system and the cardiac system together that helps provide oxygen to our body. And without that, and so if we have any dysfunction in our respiratory system or our cardiac system, that's where our tissues, the rest of the organs that rely on those two systems together, that's where if they're having an inadequate amount, then we can go into multi-organ failure, and that's definitely fatal and needs to be treated instantly. So stroke volume is made up of 3 different components: preload, afterload, and myocardial contractility. So preload, afterload, and contractility make up our stroke volume, which is the amount of blood pumped by the ventricles in each contraction. And then our heart rate is how many times per minute our heart contracts. Okay, so normal is 60 to 100. That's our pulse. All that together makes up our cardiac output. So preload is the degree that the myocardial fiber is stretched prior to contraction. So we can think about that as our venous return, or the amount of blood that gets returned to our right atrium. And I have this rubber band here. So if we think about that, if we have a lot of blood volume coming back, it's going to cause this extra stretch. And then it's going to, if there's a lot of volume, it's going to cause a big preload or a big snap. Okay, so think about your preload as just this rubber band, and it's the blood volume that's causing that specific amount of preload. Our afterload then has a lot to do with our vascular resistance. So the resistance in our blood vessels that ventricle, when it really creates that contraction, how hard does that have to work? The more resistance in our blood vessels, the harder that myocardial ventricle has to work. So the volume of blood and the viscosity of blood, which is the thickness of the blood, and that goes back to the red blood cells, so how many red blood cells there are. So if there's not as many red blood cells, we'll have a thinner or a less viscous. If we have a lot of red blood cells, such as in the case polycythemia due to chronic heart or lung conditions, we'll have a really thick blood. And of course, that's going to make our ventricles work a lot harder. Once again, peripheral vascular resistance is just the resistance in our vessels, and then the surface area or the internal area of the vessels themselves. All of that's going to affect the afterload. And then our myocardial contractility is the force generated when the myocardial muscle fibers shorten or work against each other. So here I have a picture of the skeletal muscles, the cardiac muscles, and the smooth muscles. The cardiac muscle fibers are very different than the smooth and skeletal. They have these intercalated discs that have their own automaticity. They have their own action potential generator. They can cause their own action potentials. So they're really a cool specialized muscle. When we have a greater, stronger force, we call that positive inotropism. When we have a less strong force, we call that negative inotropism. And then vascular resistance, once again, has a major effect on the blood pressure. So if we have more resistance, we'll have to have a greater blood pressure to overcome that ventricular afterload, and vice versa. If we have a lower resistance, we'll have a lower blood pressure. And once again, usually it's the plaque buildup in our blood vessels that cause this extra resistance. Okay, so talking again about pulmonary vascular resistance, there are two main, and that's why they're in red here, two main mechanisms or physiologic conditions that really create higher resistance in our pulmonary vascular bed. And when we talk about resistance, it's not from plaque buildup, but it's from smooth muscle contraction. So when we have low oxygen or high carbon dioxide in our bodies, we call that hypoxia, hypoxia, and hypercarbia. So that's generally happening when our lungs aren't doing what they need to do. What result that has is an increase in pulmonary vascular resistance. Again, when we have more resistance, that means we have a much higher blood pressure to get that moved through. So I stressed quite a bit that the pulmonary system has a much lower blood pressure, but if there's a lot of vascular resistance, that blood pressure in our pulmonary system will have to really increase. Okay, so let's read through this. Hypoxic pulmonary vasoconstriction is a physiologic response to the lung to alveolar hypoxia, which redistributes pulmonary blood flow from areas of low oxygen to areas of high oxygen availability. So this mechanism thus optimizes gas exchange and helps to prevent arterial hypoxemia throughout our whole body. Prolonged alveolar hypoxia from COPD, pneumonia, or fibrosis may result in pulmonary hypertension. And this is interesting because it's opposite to that of the systemic circulation. So due to the opposing functions of lung and systemic vessels, one taking up, the other delivering oxygen, different responses to hypoxia have emerged. So while the systemic vessels of adults dilate during hypoxia, in the pulmonary system, once again, they constrict, and that's just so they can go to areas of the lungs that actually there is oxygen available. So take, for example, if you had an area with pneumonia and that area wasn't exchanging gas, all the vessels in that area would really vasoconstrict. Well, if you think about that, if there's lots of vasoconstrictions all over your lungs, your heart is really going to work hard to push that blood flow through the lungs so it can pick up oxygen. As a result of that, we're going to have pulmonary hypertension or really high blood pressure in our lungs. Also, if we don't have the appropriate amount of blood pressure pushing that through, or blood flow going through the lungs, then it's not going to fill up with oxygen like it's supposed to at that alveolar capillary membrane. So as a result, patients can become really hypoxic, and you'll see blue lips, you'll see blue fingers. They'll have to have a high dose of oxygen to really help these patients. So one of the gases that's very therapeutic for pulmonary hypertension is something that we will provide, and that's called nitric oxide. So nitric oxide is a selective pulmonary vasodilator. So it doesn't dilate all the body, just the pulmonary artery. And that will really help to bring down the blood pressure in the pulmonary system and reduce the work on the right side of the heart and it'll allow for patients to oxygenate better. So this is kind of a funny story, but other drugs that can do that would be like prostaglandins and something called sildenafil. The trade name for sildenafil is Viagra. So we of course know that Viagra was or is marketed now for erectile dysfunction for men, but it started as a cardiac drug. And so it is also a selective pulmonary vasodilator. So there's different pathways in the body that you'll learn more about later in pharmacology, but nitric oxide, certain prostaglandins or prostacyclins, and then sildenafil can help vasodilate the pulmonary vascular bed so that your heart won't have to work as hard, and a nice amount of blood flow will come through those alveolar capillary membranes and uptake oxygen and release the carbon dioxide as needed. Here's a great picture starting with the respiratory bronchioles, and here is where pulmonary blood flow is taking place. Okay, so prior to this, it's the systemic, actually to our tracheal bronchial tree that gets provided by the systemic circulation because it's not an area where gas exchange is taking place. But here is the pulmonary blood supply. So I just really like this picture, and it shows all the surrounding clusters of alveoli with a nice healthy pulmonary vascular structure here. And of course, here is the pleura in the tissues here. So once again, this is our conducting zone where it's dead space, so there's no gas exchange taking place. And then here at our respiratory zone, this is where our pulmonary vascular system and our pulmonary blood supply takes over, and this area is where external respiration takes place. So when we were talking about anatomy, we talked about the pulmonary, how air in the pulmonary system likes to rise, whereas blood flow, due to gravity, likes to settle in the bottom. So if we look at our different pulmonary zones, we look here at the apex of the lungs, we have quite a bit of air, but we have a very small amount of blood flow. As you can see that depicted through this smaller blood vessel here, where at the bottom we have less airflow, so you can see that depicted by a smaller alveolus, but a greater blood vessel here. And then here in the middle, it's perfectly balanced. So we have to kind of think about our respiratory system or our lungs in different zones. And so we are really taking an average snapshot of the whole lungs themselves. So I mentioned before that in 1 minute, our minute ventilation, excuse me, is approximately 4 liters per minute, and our cardiac output is 5 liters per minute. So going through the lungs here, if we looked at the absolute ventilation to perfusion ratio throughout the entire lung, it's approximately 0.8, 4/5. 4 liters per minute of ventilation and 5 liters per minute of blood flow. And that's very important to keep that balance throughout the lungs so that gas exchange can be taken place. Okay, and finally to finish up, heart disease is a major contributor to mortality throughout the world, especially here in the United States. So this is the most up-to-date picture of mortality statistics from the Centers for Disease Control. So as you can see here, heart disease is the #1 reason for mortality or death. Cancer is #2. Unintentional injuries is #3. And 4th is chronic lower respiratory disease, so COPD. So if we take out unintentional injuries, because that's not disease related, COPD is now moves up to number 3. So heart disease, cancer, and COPD, and then stroke, which is also related to the cardiovascular system. All of those takes place. So we will deal with congestive heart failure quite a bit as respiratory therapists. If you look here, this has heart failure death rates. This was the most updated I could find. And here in Colorado, we do pretty well. So the darker the number, the more rates of heart disease. So the looking here through Texas and Oklahoma, and over here in Kentucky, down here, and I believe this state is Alabama. Or it's Louisiana. No, Louisiana's here. Sorry. Yeah, Georgia, Mississippi, and Alabama, I believe. So down in the South, lots of heart disease. So in summary, we have blood, heart as the main portions of our vascular systems. We really talked about blood flow, blood pressure, cardiac output, pulmonary blood flow, and vascular resistance as an influencer of all of those. So here's another picture, and continue to read and study up on this.